My name is Juan Martinez, the University of Northern Colorado in Greeley. I'm a heating and air conditioning maintenance mechanic. When I first started there, it was nice, and the benefits were good, health benefits, but they started getting more and more expensive. Right now I'm paying, just for me and my wife, I'm paying over $600 a month, just for me and my wife on my health insurance. And if I were to retire, and I think that's the main reason I'm still working, I would have to cover both, which would be around $1,200 or more a month. So it's gotten more expensive, and it's a lot harder, and it really hasn't gotten better. It seems like it's gotten worse. My wife has lupus, and I have to keep her on our insurance. And if I were to retire, I'd have to keep her on there because it's hard for me. Well, I can't find anybody else that would cover her because of the conditions that she has and the pre-existing conditions. So, and from the way I've understood it, is that if I were to stay on it after I retire and pay that $1,200, then after 18 months, then they do a review on what it's costing, and if it's costing them too much, then they can drop me, and then I'll be without insurance. No more vacations, that's for sure, because I just can't afford it because of because of how high the insurance is. Plus, my wife goes in for treatments for this lupus about every 3 months, and that's like $5,000, and out of that I got to pay $100 every time she goes in. So that's plus my insurance, my $600 plus the $100 for every time she goes in to have them treatments. So yeah, and then her pills, with her pills and her treatments, I spend around $800 a month. But if they could at least lower our insurance payments, because even when we do get a raise, which we get a raise, I think it was the last 5 years that we've had a raise, and it was like a 1.2% raise, and our health insurance went up 5%. So, you can't cover your health insurance if your pay raises are 1/4 or 1/3 of whatever your pay raise is. So yeah, if they could help us lower it, or give us at least a better benefits to where our co-pays would be cheaper than what they are now. To tell the guys that are just starting, or even have been here only 5 years, that anytime they have these lobby days, to come down, take the day off if you have to. It's well worth it in the long run. And the main reason I hadn't come is because I wasn't expecting to work for the state for this long. But I ended up working for them. So you don't know whether you're going to work here for a long time or not. But whether you do or not, these lobby days come up, time to talk to the Senate. Hey, I encourage it. Yeah, really come down and help your employees and help yourself, help your retiree, everybody, because it affects everybody. And these lobby days really help. I believe if all the state employee unions would get together in a CAPE, that our health insurance would really go down.